This video is a presentation of the Tennessee chapter of the American Academy of Pediatrics. Funding is provided by the Tennessee Department of Education, specifically the Tennessee Early Intervention System (TEIS), and the Tennessee Department of Health.
Hello, I'm Dr. Deanna Bell, President of the Tennessee chapter of the American Academy of Pediatrics. I want to welcome you to the Screening Tools and Referral Training Program, otherwise known as START. The Interpretation of Screening Results, Documentation and Referral Procedures module makes up the sixth and final video of a 2.5-hour physician-led, office-centered training program to help us all improve the care of children with developmental, emotional, and behavioral disorders. Let's find out more about what we can do to be more effective in primary care. Dr. Quentin Humberg, a developmental pediatrician and the medical director for the START program, tells us how to get started.
Welcome to Module 6 of Screening Tools and Referral Training. This module will cover interpretation of screening results, documentation, coding, and referral procedures. This module is part of 6 training modules to improve screening, identification, and referral of children with developmental, emotional, and behavioral concerns in your practice. Before you continue, please refer to the link to download a copy of the presentation. Included also will be a coding, evaluation, and cheat sheet, and some additional helpful resources. Now that you've obtained some screening information on your patients, you have to think about what your next steps are going to be. Screening provides you with a lot of useful information, but you've got to be aware that many families are not prepared for their child having a problem at your visit. Please focus on positives in terms of the child's strengths and what the child can do, and be careful not to use technical language when describing the concerns outlined on the screening tool. It's very important that you align with the family to bring them along in their need to further evaluate and follow up their child's concerns. It's also important to recognize that you can provide some things that they can do right away, part of which is to inform others that are not at the visit. The concerns that you've identified on the screening tools are always valid and should be acknowledged. You want to make sure you have open communication with the family, particularly if you're concerned that they're not going to follow your recommendations. Leave the door open so that if your concerns and their concerns do not align, that they can feel free to come back to you and discuss things further at a subsequent visit. It's important to provide the parent with information on how the referral process will work, and in the instance where you're going to refer for early intervention, that your office makes the referral to the early intervention program. Set a follow-up appointment so you can follow up following the referral and discuss next steps with the family. Currently, the best evidence we have indicates that we should communicate with our families using the common factors approach. When you identify a child with a screening tool and there are concerning symptoms or behaviors identified, we should always first communicate with the family with a statement of hope, indicating that intervention is frequently helpful to any concern that we identify. E stands for empathy and means that we should sincerely express our concern that it is difficult not only to identify a problem such as the parent is bringing to us, but also to deal with the worries of potential problems that this might bring. Language and loyalty refers to the fact that we should not use technical language when describing concerns about developmental, behavioral, or emotional concerns, and primarily reflect the language that the parent is using about their child. Loyalty, of course, is self-evident and indicates that you, as the medical home for that child, are always going to stay with them, even if you're not primarily treating the concern you're identifying. And P is probably the most important. It indicates that we should use permission, partnership, and plan. The permission step is most important because evidence has shown that if we pause for a moment and ask permission of our patients, our families, before we give them advice, they're much more likely to follow up with the advice that we've given and be compliant with the plan. So, following permission, the partnership and the plan will be self-evident in terms of the referral, and this is more likely to result in an effective referral. Now we want to spend a few minutes and talk about how to best document services provided using screening so that we can be paid. It's important that you need to recognize the value of screening tools and the proper documentation, as CPT coding allows us to capture the work involved. We want to follow the recommendations for selection and reporting screening codes commonly in use. Fortunately, understanding screening codes is not difficult. 2 primary CPT codes cover all the screening tools covered in these modules. Developmental, autism, speech and language and learning screening tools are all covered by the CPT code 96110, which describes developmental screening. Screens for mood, depression, anxiety, ADHD, behavioral, and other emotional behavioral concerns are described by the CPT code 96127, which is emotional behavioral screening. Some important clues about using code 96110 are listed on this slide. All the developmental and autism screening tools are used for this code, and it can be reported with a preventive service or with an office visit like an E&M. Please document the score in the child's record as well as the result and interpretation. Many people get confused and feel the interpretation has to be a long report, but the basis of an interpretation of a screening tool, as mentioned earlier, is just normal versus needs further investigation. It's also important to recognize that recommendations require more than one screening tool on some visits, and you may report more than one screen per visit. This is most commonly done at the 18-month visit, when recommendations indicate that a developmental screen and an autism screen are going to be done at the same visit. For the emotional behavioral screens, 96127, the reporting is just like that indicated for 96110. These tools include Vanderbilt ADHD parent and teacher forms, the PSC and PSC 35 that we have discussed in these modules, the Patient Health Questionnaire 2 or Patient Health Questionnaire 9 depression screens, and the ASQ Social Emotional 2nd edition. A modifier is often required by the payer when submitting either code 96110 or 96127. The slide here shows 2 common examples for a well child visit for an 18-month-old child where 2 screens have been administered, in this case the PEDS and the MCHAT RF, and an older child, well child visit, where the PSC 35 was administered to both the parent and the child. In both cases, notice that they selected the preventive E&M code, the preventive care code, and added the 25 modifier to indicate that a separate service was provided at the same visit. In the first case, the 96110 was given for 2 units, and in the second one, 96127 for 2 units. Please check with your billing staff and payer policy to determine the best way to submit these codes in your practice. Now that we've gone through the screening tools and some basic documentation, I'd like to spend a couple of minutes going through some of the most common resources that will help you in your practice. These 3 are the Tennessee Early Intervention System, the Vanderbilt Disability Pathfinder, and some resources in the state of Tennessee for emotional and behavioral services. TEIS stands for the Tennessee Early Intervention System. It is basically the program for all families in the state of Tennessee, birth through age 2, that have any known disability or developmental delay. The principles are based in the fact that these children are going to do best in a family-based setting, but the important part is they have to be identified in order to be referred. TEIS is based in federal law of the Individuals with Disabilities Education Act and is not income-based. There are point of entry offices across the state that we'll discuss further in a few moments. In the state of Tennessee, the Department of Education is the lead agency. The website with the regulations and further information is listed. TEIS follows a family-centered philosophy to design interventions in the family's natural environment. Best evidences and best practices show that this is the best way to help children improve with their development. The referral process that you should follow is quite easy. Basically, you're going to refer to TEIS whenever you have a concern about development or you identify an eligible diagnosed condition. The diagnosis list for eligible medical conditions is listed on this slide. The second point is that TEIS accepts referrals from parents directly or from practices, but if you've completed a screening tool, the child will have an immediate evaluation for eligibility if your office makes the referral. We are recommending that the physician's office always makes the referral to TEIS. The additional benefit of this is that TEIS will provide you a complete report of their eligibility evaluation. What are you going to need to make the referral? Basic demographic information as listed on the slide, and also current medical records. This can include a well examination completed within the last 6 months, or your current evaluation, or both. In addition, information about sensory screening of hearing and vision that you have in your record will also be helpful. As noted, current contact information for the family is also needed, as this is the most common reason that TEIS has difficulty completing their own evaluation. When you make the referral, typically within a few days, the service coordinator for TEIS contacts the family and sets up an initial intake and will schedule, with parent consent, a full evaluation. This is at no cost and involves a multidisciplinary evaluation for the child. The evaluation includes all the items listed, including the review of your medical records that you provide to TEIS. The formal evaluation tool currently in use is the Battelle Developmental Inventory and covers the items listed and provides standard scores. Refer to this flowchart to determine how a child flows through the TEIS system. Once eligibility has been determined through testing, programming is set up, and information continues with reevaluation in 6 months. Eligibility is determined based upon 2 primary ways. The first is a % delay on the standard testing that is administered by TEIS. Currently, the regulations indicate the child should be developmentally delayed in 2 areas by 25% or 40% in one area. The second pathway utilizes a diagnosed condition. This is referred to as Part B of the definition. This would be a medical diagnosis such as hearing loss, a genetic disorder such as Down syndrome, or other medical conditions that have a significant likelihood of impacting development. Conditions such as failure to thrive, or more recent concerns with neonatal abstinence or neonatal drug exposure are finding their way onto the diagnosis list. Please refer to the diagnosis list to determine if there are common conditions on that list that you are seeing in your office. All of those conditions will have automatic eligibility for TEIS. Once eligibility is determined by the TEIS team, a plan is written with parent permission again to identify needs, outcomes, and action steps to help the child improve. A very important part of the plan will be to help the child transition to school/preschool at age 3, and there's a periodic review of the plan every 6 months. Payment is often a concern for TEIS services, and it's important when you describe this to families that you reinforce to them that TEIS is not an insurance system, but is a payer of last resort, which means that they will ask the family's insurance for payment, but if that's not available, the TIS program will pay for all services listed on the individualized family service plan. Families will never pay for services that are listed on their child's plan. So as you complete the training on screening tools and referral training, we'd like you to consider being a champion for TIS. Your office can educate families on what the TIS program is and provide them with brochures and information about the TIS website. The START program can provide these to your office free of charge. Always make the referral directly to the TIS office like you would with any other medical referral, and invite your TIS personnel to come to your office and talk to your office staff. They can provide them a lot of information about the referral process and make that process much easier. Finally, educate yourself, as mentioned earlier, about the TIS eligibility diagnosis list. This will help make sure that we identify all children birth through age 2 that need services. The regions and brochures and phone numbers are listed here. For those children that require referral out of state, there is a nationwide website that will identify birth to 3 programs in all 50 states. They have different names, but they provide basically the same services as TEIS. An additional Tennessee-specific resource for your community is the Tennessee Disability Pathfinder. This is a phone or online resource to identify by county and by resource services for any disability in Tennessee, birth through death. The information can be searched by county and by resource and will provide an updated list of resources for services and treatments for a variety of disabilities. More information on the Vanderbilt Disability Pathfinder is on the link listed. Behavioral health assistance is a particular concern in many practices and in many areas in Tennessee. The phones listed provide specific referral advice, not for patients, but for provider offices. These numbers should be utilized when you identify a concern with emotions or behavior and need to look for a behavioral health professional. The phones listed have been checked and are there to help you and your practice to make a referral in a timely fashion. Some additional resources about screening are currently available through the American Academy of Pediatrics. The Screening Technical Assistance and Resource Center, STAR website, provides a lot of background information that will complement what you're learning today. START, a journey of 1,000 miles begins with a single step. More information is available at our website, www.tnaap.org.
This has been a very informative presentation for me, and I hope it has been for you as well. Thank you for joining us.